As COVID-19 pandemic precautions drop off, medical experts are worried about a resurgence of RSV, a respiratory disease that is known to particularly affect children younger than 2 years old. RSV, also known as respiratory syncytial virus, is an infection that appears to be rising in Australia and more recently in the United States. The Canadian Medical Association Journal said in a commentary this week that RSV could see a resurgence in Canada as well if new precautions are not taken. The article also claims the RSV season in Canada is usually late fall to early spring. The authors say a proactive approach is needed in Canada. Well, to talk more on this in our weekly TIA Health medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Doctor, welcome back to Forum Daily.
Great to be here.
So let's start with an overview of what exactly RSV is and its symptoms.
Right. So RSV causes acute respiratory tract illnesses in patients really of all ages. Almost all children are affected by RSV by 2 years of age, and we almost often see reinfections as well. It's the most common cause of lower respiratory tract infection in kids, especially less than 1 year of age. And for most people, it's mild symptoms, cold-like symptoms, runny nose, mild cough, but it can also cause severe respiratory disease like bronchiolitis, bronchospasms, pneumonias, and even acute respiratory failure.
Now, researchers in this article claim that this virus especially affects children who are younger than 2 years old. So why this particular demographic, Dr. Raut?
Yeah, that's an interesting question. So the big groups that are at risk are basically premature infants, very young infants, less than 6 months or younger, or children younger than 2 years old with chronic lung disease or congenital heart disease. We think it's because that the infection is so common that as you get older, you've been exposed to it multiple times. So there's this immunity to it, whereas with very young kids, they don't have that exposure.
All right, Dr. Raut. Now, we've seen pandemic restrictions starting to loosen across Canada. Can you tell us a little bit more about how the pandemic impacted the number of RSV patients in Canada?
All right, it's a great question. So RSV really spreads through droplets containing the virus. So when someone coughs or sneezes, for instance, they can also live a few hours on surfaces like countertops, doorknobs, and toys, and really easy to spread from hand-to-hand contact there. Obviously, there's some similarity here with the coronavirus in this transmission. So RSV ended up dropping very sharply in the pandemic as social distancing measures all but stopped the spread. So for Canada, for instance, only 239 tests for RSV were positive between August 2020 and May 2021, compared to what we would usually expect, which is 18,660 positive cases in 2019.
Wow, that's a significant jump, Doctor. So now we're stepping out of the pandemic. So we are seeing concern around a resurgence of this virus while immunity to it is low. So should Canadians and Canadian parents be concerned?
I think so. I think we do expect that the cases will increase dramatically, and I do expect that the majority of Canadians may experience very mild symptoms. However, I think we're still very much at risk, especially for our young children, and we need special precautions for them.
So what kind of steps can parents take to protect their infants from RSV, Doctor?
The simplest thing to do is continue all the preventative habits we've developed over the past year. Hand washing as much as possible, mask wearing, and also if you have a child at higher risk, consider social distancing to continue as well.
And going back to this commentary here, the doctors in this article are saying that a proactive approach is needed by officials. So, Doctor, what kind of steps should our leaders take before RSV season? We've got about a minute and a half left, Doctor.
Sure. So, what we're seeing is as the pandemic-related physical distancing measures are relaxed, we should really focus on healthcare providers continuing to provide emphasis on hygiene, such as washing hands. We support really the ongoing efforts to keep vulnerable infants from coming into contact with other people with respiratory illness. And other protective measures that we don't talk too much about is breastfeeding, which is quite helpful, and avoiding secondhand smoke exposure. Second, I think we should continue with the confirmatory RSV testing following usual indications to provide surveillance data. And then finally, I think pediatric ICUs should anticipate an increase in severe RSV cases. We've seen this in Australia already. So the RSV program should be prepared to even consider immunoprophylaxis off-season to the highest risk infants in case those levels get to those.
All right, Dr. Abhishek Raut from Appletree Medical Group. Always great having you on our weekly medical segment. We'll see you next time, sir.
Thanks so much for having me.